get into this particular talking point, and I think the big talking point this morning. Last night, President Cyril Ramaphosa announced that religious leaders would not be recognised as essential frontline workers, would be recognised, let's correct that, as frontline workers from the 1st of June under the Level 3 lockdown. Religious gatherings will be allowed, but limited to 50 people or less. Also yesterday, Co-operative Governance and Traditional Affairs Minister Nkosazana Dlamini-Zuma said COVID-19 has not only become the greatest health pandemic since the Spanish flu, but has also become an economic crisis. She and Health Minister Zweli Mkhize appeared before a virtual house sitting of the National Council of Provinces to brief members about the impact of COVID-19 on the country. Let's get a little bit of analysis now with political analyst Sandile Swana. Great to see you, Sandile. I'm very happy. How are you doing?
Doing very well. Thank you. I'm in good health.
That's the main thing. That's the main thing. It's the first thing that you want to hear coming from somebody's mouth. But it's good to have you on the program as well. So let's talk to the announcement last night. Religious leaders, they have been pushing to be included as essential services, and now they are. I mean, do you think that this was pressure on the president and he had to bow to this request?
Yes, you must remember that at the end of the day, the president and his cabinet are politicians, and politicians need large numbers. South Africans are very religious. If you add up all the groups, the Jewish groups, the Muslim groups, the Christian groups, you probably went towards 80% of the population. So there would definitely be major political pressure to open up that religious space. Secondly, the religious groups themselves need to feature much more prominently in charity work because the times are desperate.
You know, it is a difficult time for South Africans, and I know that many turn to religion and turn to places of worship to find almost a place of solace and a place of sanctity. But you know, there are a lot of concerns among South Africans as well, especially with regard to people going and only 50 people being able to congregate in one of these places of worship. And, you know, some saying that predominantly the elderly will be the first to want to go. You know, what are your views on this and the risk that is now going to be opened up to these people that will be going there?
Yes, ideally, your comment about the age of the congregants is very important. Any place, whether it's a place of work where people congregate, it is better if those people are fit and very healthy and young in age. Religion in South Africa has tended to be dominated by the high-risk group, the people over 60 years old, the people who have pre-existing chronic illnesses and so on. So there is no question that from a disease perspective, this is a very high-risk activity that is about to take place.
Yeah. You know, and we know that even in places of when you go to work, it's been warned that people over the age of 60 need to take care and perhaps not go back to work remotely, isolate themselves. And this is a big worry and a concern for a lot of people, that this will be the place that they go to. And this is where it might be a big spreading ground. However, there are still people saying, hang on, you're opening up bottle stores, you're opening up shopping centres, you're opening up so many things. Why not just open up the churches and other places of worship? So, you know, there is an argument, in fact, for both sides, I would imagine.
Yeah, there's one central issue. You know, I was looking at the toolbox that Dr. Zweli Mkhize presented of how he's going to tackle this now going forward. He's got 8 tools that he uses to deal with this. The one we've already experienced, what he calls the extreme lockdown, where he basically locked down the whole country. And it is based on social distancing. It's extreme social distancing. Then the other one is the social distancing that we're asked to do. When you're going to the bank, you stand in a queue X number of meters away from the next person. Then there's the quarantine. So at the core of the strategy of preventing the spread of this virus, the SARS-CoV-2 virus, is distance between people. So any activity, it doesn't matter whether it's in a bottle store or wherever it may be, in a sports facility or a church facility, the only issue that you've got to guard against is physical distance between people, and then issues of washing of hands and general hygiene. But the issue of distancing is at the center of the strategy of how you slow down the spread of this disease.
Yeah.
So it doesn't matter whether it's a bottle store or whatever it may be.
Yeah. I mean, some of the places, and let's be real. The reality is that you'll find that the floor space in some of these places of worship are not big at all. And by the time you've added the choir in and, like some people saying, videographers and the pastor and all those that are helping, I mean, you've already reached about 50 people. And who determines what congregant is allowed inside? And, you know, you wonder if this has been thought out properly enough. And it's a very, very big risk. But again, I suppose the reality here is we need to be adults and we need to think before we do things. And it's up to us now to ensure that we live consciously. This is a very, very big moment for us.
The big issue here, indeed, any Christian leader, the Christian leaders themselves have been recognized, I would imagine, as essential services where you can visit people in their homes and do other services there. Christian service is not about congregating in a physical place on a Sunday. There's a lot of other work that has been lacking for a very long time, especially since the collapse of apartheid. So they need to do that. But more importantly, people need to be aware that the risk happens afterwards. In other words, if, for instance, here in Johannesburg, we start running churches all over the show and doing all sorts of things, and we overwhelm the available hospital capacity, then you have a problem in your hands. Then we have to be rescued by other people from elsewhere. A lot of drastic measures. It will be a big drama if anybody allows things to get to that stage.
Yeah. All right. Let's turn our attention now to Minister Nkosazana Dlamini-Zuma, and many are actually saying, no, hang on, everybody. Let's wait to hear from Minister Dlamini-Zuma about the churches and about the alcohol and all of that. You know, almost saying nothing is final until you hear from Minister Nkosazana Dlamini-Zuma. But on a more serious note, what are your thoughts regarding her briefing yesterday?
I think she drove home an important point, which unfortunately got clouded when this issue of this COVID-19 started. The issue that this government has been trying to launch, and I think they've now decided to go full steam with it, is the district-based model of services provision and development, socio-economic development. So as you listen to her and as afterwards you listen to Dr. Mkhize as well, you see clearly that everything is now focused at district level. So all services will go through that. So that is what seems maybe people to mistake her that she's been given extraordinary power. But actually, if the model of development is not just a broad macro development at a national level, but they are saying development must happen and service delivery at the district level. The main entity that drives it is that. So she made that point clear, and when Mkhize followed through, it was even much more clearer. So that is where we are. And the other advantage of that is that all of us are very clear. I was looking at the map this morning. Johannesburg in Gauteng is actually a hotspot. Swana is not, I believe, and the West Rand is not. So you need to be adopting different localized strategy, localized data, and localized interventions. So that is where it all comes from.
And this is a quite an interesting one, because we heard the health minister speaking yesterday as well, talking to the fact that, hotspots should be treated differently. And we heard from the president, however, that the country will as a whole go down to level 4. But where you see these hotspots, I mean, is it fair to allow every part of the country to follow the same trajectory? Because this is a greater threat. And, the health minister, again, putting a question mark over that announcement.
No, it's actually, I think the message is consistent. You must remember that during this debate, and the debate has been very hot the past, call it 4 weeks, the idea was that let the country be free from lockdown and then target localized outbreaks and so on and so forth. Even with the economy, open the economy and target those sections of the economy that need to be closed, that are exceptionally high risk. So it's a reversal of a philosophy that has just locked down everything. So the ministers, whether it's the president, and Nkosazana Dlamini-Zuma and Zweli Mkhize, I think their message is consistent. And I think their message, their approach is becoming more data-driven, more scientific, and much more pointed where the problems are. Yeah. Johannesburg, after this, and as it goes through this, will have to revise this plan and a lot of other things, because clearly the way you've designed some of these metros and districts are conducive to the topic of pandemics and other things.
Sandile, we also heard from a lot from Minister Nkosazana Dlamini-Zuma yesterday during the briefing, talking to the fact of classism and, exacerbating the fact that South Africa has to be the most unequal country in the world. And this was again emphasized. Dlamini-Zuma was referring to hunger, poverty, unemployment, living conditions of people. However, she went as far as defending the lockdown, saying it was to protect people and curb the spread of COVID-19. Let's sort of have a look at those comments regarding classism and also the DA going at her for this particular point.
There's no question. I mean, there's no question about the issue of unfortunate and regrettable economic inequality in South Africa. The idea of colonialism itself was based on making people unequal. On top of that, you added a layer of apartheid, which was deliberately designed to make people unequal. And unfortunately, in South Africa, that added the complexion dimension. So if you are darker, you must enjoy the lowest of the lowest economic fruits of the country. And the 26 years now of independence in South Africa have not been able to crack that formula, the Forvudian formula of inequality. So what this COVID-19 pandemic has done is that it has shown those who don't have cushions, people who live, call it less than 80, maybe 35 square meters, a family living in 35 square meters of house versus somebody who's living in Sentin area, Randburg, and so on excess of 250 square meters of house. Even when you are quarantined, when you are put under lockdown, what type of lockdown do you do in a four-roomed house in Soweto or in a shack? So all of those things have been there. Secondly, people don't have enough food, cash reserves. They don't have enough cash reserves because food, you get it through the supermarket and you must use cash to do that. More than 50% of the population, larger than the population of Mozambique, in fact, were already living in poverty before COVID-19. More than 75% of the South African population had no financial security, and many, many more had no food security before COVID-19. All that COVID-19 did is to clarify that issue. Right now, Nkosazana Dlamini-Zuma made it clear in agreement with other economists and so on that 50% of the people are going to be unemployed after this whole thing.
Yeah. I want to quickly move on to two issues before our main bulletin, which I'll just ask you to give us as much as you can in a shorter period of time. Dlamini-Zuma also defending the decision on the ban of the sale of cigarettes, saying that people who share a cigarette are at the risk of contracting the virus. Does she have an opinion here that is true? I know we're going to talk to an analyst a bit later about the health risks with smoking and coronavirus, but also denying this supposed relationship with Mazotti, who is well known for the illicit trade of cigarettes. But she had to come out and defend again her reputation with regard to this. Is there more to the tobacco war, if we can say that, or is it exactly what it is? The fact that it is bad for your health?
I think, let me just make two points. The first point is that I actually went and downloaded the study from Oxford University. It's a very, very impressive study. Oxford University being a very, very top university in the world, they made the point that the disease progresses very rapidly in a smoker than in a non-smoker. And there is a clear risk that is associated with smoking in the case of this coronavirus. So that issue, scientifically, we need to debate. The other issue is that long before now, Nkosazana Dlamini-Zuma and her colleagues were able to say we must not smoke indoors, we must not smoke in the workplaces, airports, and they succeeded. This cigarette lobby did not win that battle. And it is clear that indirect smoke, secondary smoke, is exceptionally dangerous. So the scientific side, the health side, is not on the side of the cigarette lobby. Now, there are many illegal industries, including the cigarette industry. I know nothing about the relationship between Nkosazana Dlamini-Zuma and Mazote and any other smuggler. Many politicians are implicated in crime. She may be implicated in crime or not, but the science here stands clearly against the smoke.
All right, final question, and this I want to ask you again on your opinions regarding the disagreement between Health Minister Dr. Zweli Mkhize and Professor Glenda Gray. This one has been dominating all the time. We just keep on seeing articles about that. I mean, what do you make of Mkhize saying that one of his strongest critics, the Medical Research Council President, Professor Glenda Gray, has agreed to correct statements that she made about government's handling of the lockdown? I mean, it's quite scary. Gray calling on some aspects of the lockdown unscientific during a media interview, which really did irk government and rally some of the country's foremost scientists and academics behind her. Talk to us about this.
The thing is very straightforward. Either something is scientific or not scientific. And part of being unscientific, and this government has had a very long history of being unscientific. And people like Paddy also made this point several times over. And Tabombeki himself, that the planning and execution of programs by this government is not based on hard data, and that data is available from states. There are certain parts of this campaign, the COVID-19 campaign, that were definitely not based on hard data, not based on science. And they refused, I think they've refused until now, to release all the data that they used to make all their decisions and all of their models to show everybody and everything and intellectual in this country what it is that they are doing. So Linda Gray has her own organization and said there's no need to investigate this thing further. And the likes of Professor Adam Habib at Wits University have said that this is an infringement of academic freedom. And we cannot compromise on academic freedom. We cannot compromise on the freedom to think and articulate the views of intellectuals in this country.
Sandile Swana, always a pleasure speaking to you. You stay well. Thanks for talking to us. Sandile helping us unpack and make sense of some of the leading news stories that have come out so far this week. All right, just gone 7. Let's get